Chiropractic is a healthcare profession that treats and manages musculoskeletal conditions naturally without the use of medication, injections, or surgery. We treat individuals with a variety of musculoskeletal conditions such as osteoarthritis, back pain, neck pain, headaches, herniated discs, bulging discs, spinal stenosis, and also we treat a lot of sports injuries such as sprains, strains, and we treat a lot of post-surgical patients too as well. And chiropractic actually means done by hand. So when you visit a chiropractor, typically we will be doing some kind of hands-on techniques to our patients. That can range anywhere from stretching to massage, mobilization, which is just slow, gentle movement of the spine or extremities done by the chiropractor to the patient, and even manipulation, what classically is known as the chiropractic adjustment. And a lot of times that's associated with some kind of cracking or popping, what most people would think of when they hear someone's going to a chiropractor. But what people do not know is that the cracking or popping, which is a manipulation, which is associated with the manipulation, is not required or mandatory to be done on any or all visits. And to get significant relief of pain, you do not need to be manipulated or have anything cracked or popped or anything forceful. Because what we're doing when we treat patients is trying to influence the nervous system. And that's really how chiropractic helps people. We used to tell people and we used to think that chiropractors are feeling for joint misalignments or we're putting bones back in place or taking pressure off nerves. And that would be an explanation of why people feel significantly less pain after a chiropractic treatment. What we now know through research is that the chiropractic treatment techniques employed are actually a powerful stimulus to the nervous system to actually help to change pain perception. So it actually alters the way the body processes and produces pain. And it's pretty amazing because the fact that we're able to provide that service to patients naturally with our hands and reinforce that with exercise, diet, other strategies such as sleep improvement and stress reduction, all geared towards changing the perception of the nervous system, is pretty amazing. Because as far as medicine goes, the solution for that is to take prescription medication a lot of times. And that's why we're in this opioid epidemic, because opioids definitely do help to relieve pain, but with significant problems and side effects. And it's definitely not something that you want to choose, especially for long-term management of pain. So the fact that we as chiropractors have something significant to offer that's natural and with less side effects is pretty amazing. And that's why, I'm pretty passionate about what I do and how I'm able to help people. So essentially the way we help people, like I said, is by changing the perception of the nervous system or changing the way the nervous system perceives pain. And a simple analogy I like to tell patients is that we simply help to stimulate the body's own natural pain medicine cabinet. So we help to open up the pain medicine cabinet. It releases happy pain relieving hormones such as endorphins and enkephalins. And when we're working on patients, that relief is usually short term. If the patient only comes, lays on the table, once or twice a week, we work on them, they get up and feel better. If that isn't followed up by exercise or rehabilitation and other lifestyle changes such as improvement in diet, improvement in stress reduction, sleep improvement, usually the results are not going to be long-term or long-lasting. So by showing patients and teaching patients how we could help themselves and reinforce what we do in the office with a custom program for them, that leads to most often a better outcome in the long run for patients. But again, all the strategies that we employ are to help improve and change the way the nervous system is producing pain, and we're trying to actually help to relieve pain by influencing the nervous system, not putting bones back in place. And that's why you don't have to get a forceful cracking or popping treatment to get significant relief of pain. Again, just like somebody would take an opioid medication, they're not changing any structure or anything, they're just changing the chemistry in their brain and they're getting pain relief. That's what we're trying to do and stimulate our patients naturally. I hope this post was informative. If you have any questions or if there's any topics that you would like to hear more about or questions that were answered, I encourage you to email us at doctors@distanocchiro.com, and somebody will definitely get back to you, and maybe we'll make a future post about your question.